Hello, welcome to today's class. In today's video, I'll be teaching on what is pharmacology and why it matters. Alright, let me start like this. If I walk into an exam hall right now and ask you one question, after you swallow a tablet, what actually happens next? Most students will say it gets absorbed, enters the blood, and works. That answer will cost you marks. Because between swallowing a drug and that drug producing an effect, a lot can go wrong. Acid can destroy it, enzymes can change it, the liver can inactivate it, the kidneys can remove it too fast. And even if that drug survive all of that, it still has one final challenge: finding the right target at the right dose in the right patient. That entire journey from entry to effect to exist is what pharmacology is really about. And if you don't understand that journey, you will struggle. Not because you are not smart, but because you are memorizing without a map. Let's talk about what pharmacology really is. Now, formally, you will see this definition everywhere. Pharmacology is the science of drugs and their interactions with living systems. But let's be honest, that sentence alone won't help you in an exam. So let me translate it properly. Pharmacology explains why adrenaline increases heart rate, morphine reduces pain but suppresses breathing, some drugs work only on an empty stomach, and some drug combinations are dangerous. It connects chemistry to physiology, and it also connects molecules to real patients. Without pharmacology, prescribing becomes guessing, treatment becomes trial and error, and the patients pay for those mistakes. That is why pharmacology is not extra knowledge, it is the language of therapy. The scope of pharmacology. Many students think pharmacology is just drug used in the hospital, but let me tell you that is incomplete. Pharmacology includes drug you prescribe, drugs you warn against, substance people misuse, herbal products that don't tell you about poisons and antidotes. Pharmacology explains drug interactions, side effects, allergic reactions, overdose, drug resistance. So when a patient says, "This drug worked for my friend, why not me?" that question is pharmacology. When a drug saves a life or causes harm, that is pharmacology. There are a lot of reasons why students struggle with pharmacology. Let me say something important. Pharmacology is not hard because it is complex. It is hard because it is dense. Too many students try to memorize drug names, mechanism of actions, side effects, but memorization without understanding is fragile. Once the exam ends, everything disappears. Your brain remembers stories, not lists. It remembers images, not paragraphs. That's not immaturity. That's neuroscience. That is why this channel uses visual and structure to turn confusion into logic. Here, let me help you with two core ideas. Every single drug, no matter how advanced, can be understood using two questions. First, what does the drug do to the body? These include receptors, enzymes, ion channels, and physiological effects. Now let's talk about the second one. What does the body do to the drug? These include absorption, distribution, metabolism, and excretion. If you understand these two ideas, you can understand drugs you have never seen before. That is the mindset that helps you pass pharmacology. As a pharmacologist or an health science student, have you ever wondered why pharmacology matters in real life? Okay, in real patients, drug never exist alone. Patients have other diseases, other drugs, different ages, different genetics. Pharmacology helps you answer, is this drug safe? Should the dose change? Will it interact? Mistakes in pharmacology don't stay on paper. They show up as adverse effects and real harm. That responsibility is heavy, and that is why understanding matters. This channel is not here to replace your lectures. It is here to help you survive them. I won't flood you with facts. I will flood you with mental anchors. By the end, mechanism will feel logical to you, side effects will make sense, and exams will feel far more predictable. This is pharmacology, taught for your understanding and not fear. Pharmacology is not about memorizing chemicals. It is about understanding how small molecules can create massive effects. If you are ready to truly understand drugs, then your journey starts here. Please don't forget to like and subscribe if you found this video very useful, so that this video can reach out to more people out there. Thank you and see you in the next class.